We are all aware about the brain stroke or the paralytic stroke and its devastating complications. We know that it occurs because of reduction in the blood supply to the brain. However, the lesser known entity of stroke is hemorrhagic stroke, which results from bleeding in the brain. It can either be bleeding in the brain substance or it can be bleeding in the coverings of the brain as a result of rupture of aneurysms in the blood vessels. What is an aneurysm? An aneurysm is a focal swelling or a kind of bubble which forms on the surface of this blood vessel, which is a weak point at which, due to various causes including high blood pressure, the blood vessel ruptures, giving rise to bleeding either in the brain substance or in the covering of the brain. In the past, we were limited in terms of treating these lesions by means of only conventional neurosurgery by the procedure of so-called clipping. However, later in the early 90s, we had the detachable platinum microcoils and we could treat these aneurysms much more effectively, followed by the advances in technology like balloon-assisted coiling and the stent-assisted coiling, which improved the treatment response as well as allowed us to treat a much larger variety of aneurysms. Different complex varieties of aneurysms we could treat. However, with the further advancement and availability of devices, the so-called flow modulation device or the flow diverter, it has expanded the application for aneurysm treatment today. It is a specialized kind of a stent with a closed cell design. The big advantage of this device is not only bridging the neck of the aneurysm, it helps in diverting the flow away from the aneurysm and towards the parent artery. Diversion of the flow helps in stasis of blood in the aneurysm, thereby resulting in clot formation, and subsequently the layer of endothelium forms on the surface of this device, incorporating the device into the main artery, thereby healing at the neck of the aneurysm. So this is a new way of treating the aneurysms which has expanded the applications. This is a young lady, a 28 years old female who presented with intermittent headache since 1 year, and here we find that the aneurysm is fairly large in size, requires device placement as well as coils to support the coils, and post coiling and flow diverter placement, we find that there is complete healing of the aneurysm. The check angiogram done at 6 months shows that there is no flow further in the aneurysm. Devices are today available with special surface coating which helps in reducing the risk of blood clot formation. The coating as well helps to make the device smooth, which helps in the navigation of the device, helps in faster healing and increased safety for the patients, because the requirement for the dual antiplatelet drugs is definitely minimized by the placement of this coating, thereby reducing the complication of bleeding for these patients.